Well, hello, I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips to help you thrive in nursing school and beyond that at the bedside. Today is number 4 in my Ask Me Anything series, which we're doing over the summer while many of us are on break. I wish I was on break. I'm working a ton actually this summer. But if you're a student, you might be off for the summer. And I wanted to take this opportunity to answer a lot of questions that I see or get asked about nursing school. Now, before we dive into today's Ask Me Anything episode, let's take a quick minute for our listener shout out. This shout out goes out to Maybe, who says, honestly, what would I do without Straight A Nursing's Crucial Concepts Bootcamp? I feel so much more prepared and confident about starting my accelerated BSN program in a month. This simple yet detailed roadmap makes it easy to turn anxious energy into productivity. Love, love, love. Maybe, thank you so much for sharing your experience with bootcamp. I'm thrilled that it's making you feel less anxious and more productive and ready, and also thrilled that you loved it. So if you're wondering what Maybe is talking about here, she's talking about my Crucial Concepts Bootcamp, which is a nursing school prep course, which helps get you set up for nursing school success. It includes all kinds of topics ranging from medical terminology to nursing communication, approaching care plans, nursing diagnoses, critical thinking, tackling NCLEX style questions, organization tips, how to do notes, and of course, dosage calculations. So if you'd like to check that out, go to straightanursingstudent.com/bootcamp to learn more. And I'll also put a link in the episode notes. Alrighty, let's dive into the questions. So the first question is, what's the difference between working in the ER, telemetry, or the intensive care unit? So I think this question came through from someone who was starting to embark on their job hunting as they were nearing graduation, but it also applies to students looking at clinical, because in clinical, you are working in these departments. So let's first start with the emergency room. For the most part, if you're a student, you will do your emergency room rotation if your school has that option for you as part of your advanced med surg or critical care course. And in the ER, the key things are high turnover of patients. So lots of patients. Like I said, high turnover, you might have a patient for a short amount of time, get them discharged or get them admitted and then get another patient. But all the while, you've got multiple patients all going through this process. So it's a very, very busy and very dynamic environment. In the ER, you will also see anything and everything. Now, a lot of ERs are organized in such a way that peds will go to one area, and then the adults will go to another area, but not always. In some ERs, depending on how they're structured, you might see kids, you might see adults, you might see little tiny brand new babies. So you could see absolutely anything and everything. And you'll see all kinds of cases. You'll see people with cardiac issues, people who have coded and been brought in on the ambulance under chest compressions. You'll see patients with GI bleeds, pneumonia, shortness of breath, like just absolutely anything in the world. You'll also get a lot of patients suffering from mental health disorders who are in crisis. So the ER is a great place to work if you thrive in chaos, if you love every shift, every day, every hour even being different, and if you enjoy working with a wide variety of people in a wide variety of ages, suffering from a wide variety of conditions. Now, in the ER, I would say that successful nurses in the ER can learn very quickly, are very, very skilled at their hands-on tasks because you've got to do so many things for these patients that come in. that you have to be able to do them quickly and efficiently. A strong ER nurse has absolutely just stellar assessment skills because people are coming in and they might just have vague complaints. You have to be able to know what you're watching for, know what you're assessing in this patient so that you can catch important things to relate to the physician and also catch changes in condition. ER nurses are also, I would say, thick-skinned. That's a great way to put it. They're tough. They're not going to let people being angry or a patient having a mental health issue who's very difficult to manage, they're not going to let that fluster them. They're going to be able to handle that. So those are probably kind of the key highlights of the ER. I've never worked in the ER. I did some clinical time there. I've popped in and out a few times as a nurse. And what I've seen from ER nurses is that they are total rock stars. They're absolutely amazing. They can handle absolutely anything, and they thrive in that environment of never knowing what's going to happen next. And some people really, really love that. So that's kind of a key overview of what it might be like to do your clinicals or work in the emergency room. And then telemetry and the ICU. Those are both units in the hospital where patients have been admitted. So in the ER, the patient has not been admitted yet. They're an emergency room patient. If they're admitted, they might go to telemetry. Now, there's a bunch of other floors in the hospital: med surg, ortho, oncology, surgical floors, all of that. Telemetry is different from a lot of those because the patients are on telemetry monitoring. And this is generally because they have some underlying cardiac issue, and we need to watch their heart rate, heart rhythm very carefully. So on a telemetry floor, you might have patients who are there with pacemakers, who maybe have a brand new pacemaker inserted. You may have patients who have an LVAD, a left ventricular assist device. Maybe they're not there for anything related to their LVAD. Maybe they came in for gallbladder surgery, but because they have the specialized cardiac equipment, they're going to a telemetry floor. You'll have patients that have had, say, cardiac catheterization procedures like an ablation that need to stay overnight. They're going to go to a telemetry floor. Or you've got a patient with bad heart disease. They need to be monitored. They're going to a telemetry floor. So even though it is a specialized type of unit, you'll still see a lot of variety, but it will be heavily skewed towards cardiac. So a telemetry floor is, in a lot of cases, and it depends on the type of patients that you're seeing. In the hospital where I work, there's several different subtypes of telemetry, and the patient ratios change a little bit depending on the acuity of the patients. But for the most part, where I work in California, where we have patient ratios, the telemetry floors are 4 patients per nurse. In some cases, it might be 3 patients per nurse if the patient does require more advanced interventions and monitoring. But for the most part, you're looking at a lower patient ratio than you would see, for example, on a med surg floor. And again, you're looking at patients with cardiac issues, underlying cardiac issues, chronic cardiac issues, and acute cardiac issues. Telemetry is a very, very busy unit. So just because you might have fewer patients does not mean you're any less busy. I honestly don't know if I could handle working on a telemetry floor. Those patients are complex, they're very busy, and those nurses they're also total rock stars. I'm just going to go ahead and say it. I've always been so impressed with the tele nurse's ability to juggle multiple patients who all have some pretty high level needs. So if you love cardiac, if you enjoy working in a fast-paced environment and want to possibly have a slightly lower patient ratio so you can get into your patient's history and really get to know them and understand what's going on with them. Now, of course, this depends on where you live, then telemetry might be for you. You do have to be very confident in your skills and your assessment abilities to work on telemetry because these patients can change quickly. and they can have cardiac problems. And this means patients on telemetry, you might have more code blues on telemetry than you possibly might on, say, a med-surg floor. Ideally, we catch the patient who's deteriorating more quickly because they are on monitoring, but just be aware that those things can definitely happen anywhere in the hospital and for sure on a telemetry unit where the patients already have underlying cardiac conditions. And then there is the intensive care unit, which was where I started out as a nurse. And the intensive care unit is going to be a highly specialized unit where the patients are the most ill, the most critically ill of the hospital, requiring the most advanced interventions and most frequent assessments. So in the ICU, in California, I don't know about other states. I do feel like in other states, it is possible to have 3 patients in the ICU. Here in California, it is maxed out at 2 patients per nurse in the ICU. And if the patient is very, very sick, it would be 1 patient, 1 nurse. Does this mean you're less busy? No, it does not. Keeping someone alive is a lot of work. So I don't want you to think, well, I want to only have 1 or 2 patients, so I want to work in the ICU because that will be easier. It's definitely not easier. It's just different. All these areas of nursing are challenging because nursing is a challenging and difficult job. The reasons why it's challenging are going to vary depending on which department you're in. So in the ICU, you might have patients who are on ventilators. That's very, very common. They are also on continuous telemetry monitoring. You're looking at their vital signs constantly. You may have patients who are hemodynamically unstable. So they're requiring medication, basically life support medications to keep their blood pressure up, to keep their heart rate within the desired range, things like that. So in general, an ICU nurse who excels in this environment has great attention to detail, likes things to be a little bit more orderly than in the ER. Maybe they just like to have a little bit more control over their environment. And they really enjoy super deep diving into their patients' medical histories, their diagnoses, their plan of care, and working on complex nursing interventions to help the patients meet their goals. So those are kind of the key differences between these different departments. Now, as a student, maybe as a student doing clinicals in these departments, in the ER, you're going to see all kinds of stuff. You might get to do chest compressions on somebody. Hopefully they make it. You might get to do a lot of hands-on stuff because there's just a lot of hands-on stuff in the ER. And then in tele, you're going to get an introduction to hemodynamics and into cardiac function and into juggling patients who are sicker than they were on your med-surg floor in your basic med-surg class. And then in the ICU, you're going to be really diving into oxygenation, ventilation, perfusion, hemodynamics, and complex monitoring equipment. So I hope that helps you understand the differences between these 3 key departments that you might encounter as a student in an advanced med-surg clinical situation. Alrighty, speaking of clinical, I get asked all the time about what supplies are must-haves for clinical. And you'll see a ton of information out there on this. I've been a nurse for 1 million years now. It feels like 1 million years. It's not. It's been since 2011. And I can basically tell you the things that are absolutely necessary that I rely on all the time. So numero uno, compression socks. When I started wearing compression socks for my 12-hour shifts, it was night and day. I've told this story many times. Maybe you've heard it before if you've listened to this podcast for a while. But working in the ICU, in general, I would be totally done by the end of the day. Absolutely wiped out. Do not pass go. Straight home, shower, snack, fall asleep on the couch for a while, and then go to bed. That was my routine. The first day I wore compression socks, I felt good enough to meet a friend afterwards for margaritas and chips and salsa. Okay? I'm not going to lie. It was amazing. Did I do that every day? No. But I felt such a difference. I kind of was like, hey, I think I could go out for a little bit after work. That sounds fun. So compression socks are great for helping reduce that fatigue in your legs and in your feet. Okay, speaking of feet, we have to have comfortable shoes. This morning I was looking through Facebook groups I like to visit Facebook groups to see what students are talking about and the things that they're struggling with. And I cannot tell you how many posts were asking, what shoes should I wear for clinical? Because comfortable shoes are so, so important. Now, only you know what kind of shoes are comfortable for you. I would suggest just going and trying on a bunch of different shoes. Yes, people are going to tell you Hoka's, On Clouds. What's the other one? There's another one, Cloves. That seems to be really popular right now. Danskos were the thing when I was in school and a new nurse. So you're going to hear all kinds of things. You'll see one person say Cloves were the best. Another person will say they hurt their feet. Another person will say On Clouds were the best. Another one will say Hoka's were the best. You have to basically just go try on a whole bunch of shoes, okay? So don't rely on what is comfortable for someone else's foot. Feet are so individualized. Go to a uniform store that sells scrubs. They will have a variety of shoes, most likely for you to try on. Those are going to be more of like the nursing standard shoes. They'll have Danskos there. They'll have other brands of nursing shoes. I personally wear clogs, Klogs. It's either Klogs or maybe there's two G's in the name. I'm not sure. And you can try those on a lot of times at a uniform store. And then go to like a walking store and try on shoes there. And then go to a store that sells sneakers. If your school will allow you to wear lace-up shoes, sometimes they won't. Sometimes the shoes have to be all leather with no canvas. So there are some guidelines around this because they want you to be able to wipe them clean easily. But go to like I want to say like a running store almost, but like a store with a lot of sneakers and try on the Hoka's and the On Clouds and all of that. And then decide what's most comfortable for you, okay? Don't go off what somebody else says is more comfortable for them because their feet, their body is different from yours, okay? Now, with comfortable shoes, there is another factor that I will throw in, and this is actually what I think is the key, and that is insoles. When I started putting insoles in my clogs, it was another game changer. That is right up there with compression socks. Absolutely amazing. My feet are supported. They're in great position. I don't have any fatigue with my feet at the end of the day. I feel pretty darn good. So look at getting some insoles for your shoes. I use ones from a brand called Sole. I believe it's just Sole, and they're great. And I get the ones, they're red. There's different thicknesses. The thickness I got is the red color, and I wish I could remember what it was called. It was just kind of an in-between thickness and support, and they're absolutely perfect. So if you've got some shoes that you like, but maybe don't love, but they meet the criteria for your nursing program, I would suggest getting some insoles, and that might elevate that shoe that's like at a 5 or 6 all the way up to a 10. Okay, the next thing is a pair of hemostats. I use these all the time. I used them just yesterday because somebody with much, much stronger hands than me had screwed on the IV tubing so tight, there was no way. I could not get it off. Got out my hemostats, held down one side to secure it, and was able to easily unscrew the IV tubing. And that's basically what I use hemostats for all the time, is when I cannot get IV tubing to disconnect. You want to get the kind with a little bit of teeth to them. Some are smooth. Those are a little harder to grip with. Get the kind with the teeth. Now, here's a side note. If you're ever clamping a Foley catheter or a chest tube, you're not going to use your toothy hemostats to do that because you would damage the material. And as a student, you're not clamping chest tubes anyway. But you might want to clamp a Foley catheter for 30 minutes to obtain enough urine for a urine sample. And if you use a hemostat for that, make sure it's the smooth ones so that the teeth don't cut into the tubing and cause a breakage so that bacteria can get in. Okay, so hemostats are great. Use them all the time. Next are utility scissors. I use these all the time. I actually lost my pair, and I'm a little panicky because every day I'm at work, I'm like, oh shoot, I forgot to look for my backup pair of utility scissors. How am I going to get through my shift without them? I use these a ton. Here's what I use them for. IV bags are in these really thick plastic bags. And sometimes if my hands are even just a little bit damp from putting on hand sanitizer, or even a little bit greasy is probably not the right word, but if I've just put on some moisturizer, some hand lotion, I cannot get those bags open. And some of them are just hard to get open anyway. So I use my utility scissors to get into them so that I can get the IV bag out of that really thick plastic bag that it comes in. And then I also use them to open up pill packs. A lot of times pill packs are I think they're adult proof and not just child proof. They're nurse proof as well. And the easiest way to get to the medication is to just cut through that blister pack to get the medication. That's essentially what I use utility scissors for. Now, in the emergency room, you'll see nurses carrying much bigger scissors. These are called trauma shears. You don't need these for your clinical on the med-surg floor, your clinical in tele or the ICU. Trauma shears are if you're going to be cutting clothing, blue jeans, heavy articles of clothing off people that have come in from trauma where you need to get down to the skin. So basically, just a little pair of utility scissors. Absolutely perfect. I love them, use them all the time. Also, obviously, a stethoscope. You want to get a stethoscope that you can hear from. And I honestly use a Littmann Master Classic 2. I don't know if the 2s are as available now. I think maybe the 3s are more available now, but that tells you how long I've had my Master Classic 2. Got it in 2011. Guess what? It works great. So here's the thing about stethoscopes. Students often get a little nervous about their stethoscope, thinking they need to spend a lot of money on a high-end stethoscope because that will make it easier for them to hear breath sounds, lung sounds. Well, I guess that's the same thing, right? Breath sounds, bowel sounds, heart sounds, all of that. What I would say to this is it's not necessarily that you need the super expensive stethoscope. You just need to train your ears to hear the sound. So practice listening to different sounds, learning what they sound like so that you can acutely listen for them and tune out the extraneous noises. Okay, so those are the key things about a stethoscope. It doesn't always mean you need to go buy a super expensive $300 electronic, what have you, stethoscope. You just need to spend a little bit more time training your ears. Now, of course, if you have a hearing impairment, that's a whole other thing. I will trust that you will find the best stethoscope that works for you in that case. Aside from that, you want pens and something to take report on. And honestly, that's about it. For a student in clinical, a clipboard is great because you will have paperwork. You'll have things that you need to gather data for your care plans and all of that. So getting a clipboard that either folds up and goes in your pocket is great. The only thing about that clipboard that I don't like is that your papers then get all folded and kind of messy. But the nice thing about it is that it fits in your pocket. What I liked to use when I was a student was a clipboard that had a storage compartment in it. The reason you don't want to just have your papers out is because they may contain some patient information, right? So you want to make sure that your papers are always secured, either folded up in your folded clipboard or in a storage clipboard inside, so that if you leave it laying on the nurse's station to go run into a patient's room, nobody's seeing any patient information. Plus, you don't want to lose any of your paperwork that you need for your clinical homework. And honestly, that about sums it up for clinical. You don't have to get super complicated with this. Those are the things that I use the most. Now, I would say when you get to clinical, I like to put stuff in my pockets that I'm going to be using throughout the day. So get some alcohol swabs, pop those in your pocket. It's going to come up where you need an alcohol swab and you don't have an extra hand or the ability to leave the patient and go get one. So getting some alcohol swabs. I like to put a couple of those finger stick devices in my pocket because when I do a finger stick on a patient, if I don't get it on the first try, I like to have a backup in my pocket just in case. We are not supposed to walk around with flushes in our pockets. You will see nurses doing that, and that is technically not allowed. So don't let your clinical instructor or your preceptor see you doing that. But I will say, happens all the time. And I, for one, have always been super appreciative when a coworker's had a flush when I need one because they pulled it right out of their pocket. But technically, we're not supposed to walk around with those in our pockets anymore. And then those little things that you put on the end of the IV tubing when you disconnect it and you need to cap it off to keep it sterile. If you can have a few of those in your pocket, that's great. Sometimes they're in the room hanging off the IV pole, depending on the type that your facility uses. That's about it for my pockets. So there you go. Clinical supplies that are absolute must-haves. Okay, now let's take a quick break. And when we come back, we'll talk about 2 questions, the difference between AP1 and AP2. So if you're a new student, you want to listen in for that. And the difference between subjective and objective. See you in a minute. I love hosting parties. In fact, my friends have called me the hostess with the mostest on more than one occasion. And a key ingredient to hosting a great party is having great wine to share. And with First Leaf, I always have fabulous options to choose from. And that's because First Leaf isn't your standard wine club. It's so much better. Instead of getting selections from just one winery, each shipment is a personalized selection of wines from around the world. And because of First Leaf, I've discovered that I love the white wines from South Africa, Washington, and Australia. Wines I probably wouldn't have discovered on my own. Not only have the prices been amazing, but the wines have been so good. I love a crisp, refreshing white wine, and First Leaf knows that. So that's what they select for me, and every bottle has been a winner. I can also tailor my membership. Choose 6 or 12 bottles, determine how many reds or whites I want, and even select a shipping window that works for me. So get wines to sip and share at your next summer party with First Leaf. Go to tryfirstleaf.com/nursemo to sign up, and you'll get your first 6 hand-picked bottles for just $44.95. That's tryfirstleaf.com/nursemo. Tryfirstleaf.com/nursemo. Alrighty, we're back and we're talking about the difference between AP1 and AP2. And the reason I think this is important to understand is because they're not always the same depending on where you go to school. So just earlier today, I saw somebody advising another student that AP1 is just memorization. Don't worry about it, just memorize and you'll be fine. That only applies if AP1 is taught in a particular way at your particular school. So let's talk about the differences here. In some schools, AP1 is anatomy and AP2 is physiology. And that is the case of that student advising another student that AP1 is just pure memorization, because where they went to school, obviously, AP1 was just all anatomy. And I'm not going to lie, she's right. Learning anatomy is memorizing anatomy. That's all there is to it. However, a lot of schools divide this up differently. And the school I went to for my prerequisites did it this way. AP1 was half the body, so all the anatomy and all the physiology for half of the body systems, and AP2 was all the anatomy and all the physiology for the other body systems. So if that's how your school does it, and someone tells you, well, for AP1, you just need to memorize, that is not going to be good advice, because for physiology, it's not memorizing. It's understanding the physiological concepts. So it's important to know how these are structured at your school when you are seeking advice or tips on how to study, that you don't think you're doing something wrong because someone assumed AP1 is taught as just anatomy and tell you, just memorize, and then you try to do that and you're struggling because your AP1 is actually also physiology. So does that make sense? I hope that makes sense. And just know that you will need to divide your time equally between spending time memorizing the anatomy and then spending time reviewing the concepts about the physiology. And I believe AP1 1 was the first class I took where I really started rewriting my notes into my own words. And that made a huge, giant, enormous difference in my ability to understand physiological concepts. Another tip for A&P is to utilize the textbook extra resources. So the textbooks that I utilized for each class came with all these great online things, like things to label so you could study anatomy, crossword puzzles, flashcards, quizzes, just all this kind of engaging, dynamic content that really helped me learn the anatomy component as well as the physiology component. And they were kind of fun to do. So if you find that you're getting in a slump and you're like, ugh, I'm kind of tired of staring at the bones of the cranium, then pull out your textbook resources and see if you can tackle it in another way that keeps your engagement up, keeps your brain firing all those neurons and really learning and committing that content into your memory. I have some more study tips for anatomy and physiology, which I will link to in the episode notes. And then one more common question that comes up because students initially often struggle with this one, and that is the difference between subjective and objective. So you'll come into this when you're learning about assessment and you're learning about your patient's signs and symptoms, and your professor may want subjective data and they may want objective data and they might want that separated out. So it's important to understand the difference. So subjective data, think of it as information you get from the subject, which is the patient. This is the patient telling you their own experience. This would be things like how they feel, their pain level, the quality and the location of their pain, whether they're experiencing anxiety or shortness of breath. Maybe it's them telling you how far they can walk before they have to sit and have a rest, itchiness, nausea. All those things are subjective because you, over there, talking to the patient, looking at them, can't tell if they're nauseous. You can tell if they're vomiting, but you can't tell if they're nauseous. You might look at them and think, wow, they look like they're unwell, but you don't know exactly what's going on. Only the patient can feel their nausea. So that would be subjective data. We have to rely on the patient or the subject to share this information with us. So when we look at signs and symptoms, subjective data are the symptoms. These are the things that are experienced by the patient. And then objective data is the data that you can observe. So think objective, observe. And this would be all of those things that you can glean from your physical assessment of the patient, like their vital signs. That's objective data. How their wound looks, what their blood sugar level is, or how much drainage is in a chest tube. All of that is objective. When we look at signs and symptoms, objective data is the signs. These are the things that are being displayed for you to observe. So subjective is what the subject experiences. It's the symptoms. Objective is what you can observe, and that is the signs. So let's do a little bit of exercise to drive this point home. Which of these is subjective or objective? Ready? What if the patient says they feel dizzy? That is subjective. Very good. What about if the patient falls down? That's objective. They were dizzy and then they fell down. You were able to observe them falling down. What about the thermometer reading 98.7 degrees? That is objective. You were able to observe that. What about a patient stating they feel cold? That is subjective data. The patient is cold. Now, unless they're shivering and chattering their teeth and have hypothermia, you would not be able to determine that they are cold without the patient telling you. So if the patient says, I feel cold, could I have a warm blanket? That's subjective. If the patient is shivering, that's objective. Okay. What about the patient's urine output is 40 mils for the past 2 hours? That is objective data. You can observe that and measure that. What about the patient saying, I have pain in my leg? That is subjective, right? The subject is experiencing that. And then what about your patient who has to pause after every 3 words to take a breath? That is objective data because you're able to observe that the patient is having to pause to take a breath, and this typically occurs because of some underlying respiratory condition. The patient has shortness of breath. So if that was helpful to you for that quick little review, that's just a little example of the types of things that are in Crucial Concepts Bootcamp. That's a little mini lesson inside Bootcamp, actually. I go into more detail, of course, in Bootcamp. And the reason it's important to understand these concepts, in my opinion, ahead of time is because when nursing school starts, it's game on. It's so busy and intense. And if you have to go back and kind of relearn or learn new things like, oh, shoot, I guess I don't know the difference between subjective and objective, that's going to slow you down and pull you away from learning the key things you do need to know, like how do I take care of a patient with pneumonia, right? That's the most important thing. So Crucial Concepts Bootcamp teaches some basic underlying concepts that are crucial, right? It teaches some basic underlying concepts so that when you get into your program and you start hearing these terms and all these different things about nursing, you're not hearing them or experiencing them for the very first time. And then you can focus in on the key things you actually need to be learning. You'll save a ton of time, you'll have a ton less anxiety, be far more efficient and far more productive. So that's just a little taste of what's inside Crucial Concepts Bootcamp. So I'll put a link in the episode notes for that. I hope to see you there inside Bootcamp. That would be fantastic. And I hope to see you here next week where we are diving into some key things to know about pediatric clinicals. So if you're a continuing student and you're going to be starting your peds rotation, I'd love for you to pop back in next week for that. And then if you're that new student, I have a free video, kind of a free video training I'd love to share with you. It's called How to Thrive in Nursing School Without It Taking Over Your Life, because we all want that, right? I'll put a link in the episode notes for that. Or you can go to straightanursingstudent.com/thrive to check that out. And in this free video, I dispel some nursing school myths that when students believe these 3 common myths, they tend to struggle more in nursing school. So if we can dispel those, do things a little bit differently, you'll actually be in a position to thrive without it taking over your life. So again, that link is in the episode notes, and I will see you back here next week. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com, and for more nursing-related content, go to straightanursingstudent.com.
At a time when change is constant and we are pulled in far too many directions, we need a way to stay present to life and to increase our ability to remain calm, think clearly, and maintain our well-being. Many studies indicate mindfulness improves our mental, emotional, and physical health. On A Mindful Moment with Teresa McKee, you can learn how to practice mindfulness and enjoy its many benefits. Tune in for guided meditations and to hear tips and advice from some of the most respected experts in the fields of mental health and mindfulness. The world truly can be a better place. It all starts with a mindful moment.